Good evening. Welcome to the May 15th, 2023 Yarmouth Board of Health meeting. This is a reminder that this is a hybrid participation meeting. You can attend online by following the directions at the yarmouth.gov website. I'm going to start by taking the roll. Charlie?
Beg pardon?
Charlie, you're present?
Yeah.
Okay. And Eric is present online. Eric?
Present.
Okay.
How are you?
Fine. And I'm Mary Craig. I'm the vice chair, and I'm sitting in for Hillard Bosky, the chair, for this evening's meeting. The first section is public comment. This is when anyone in the public, in person here at the town hall or online, can make a comment or ask a question. We're not allowed to discuss or respond to it unless you are making a comment during the agenda part of the meeting. Are there any comments? I don't see any here in person. Are there any online? Doesn't look like it. Okay, we'll move right along. The second agenda item is an update from Meg Payne. She is from the Visiting Nurse Association. She's the Director of Public Health and Provider Relations and co-chair of Healthy Living Cape Cod. So Meg, would you introduce yourself and fill us in?
Sure. Hi, I'm Meg Payne, Director of Public Health and Provider Relations for Visiting Nurse Association of Cape Cod. Thank you for having me. It's been a few years, so I'm happy to come and update you on all the great things that we've been doing. Just to start from the beginning, I guess, we serve as the town public health nurses for the town of Yarmouth, and we provide an array of services. We have a handful of clinical nursing services, and then we also have several wellness programs that we've been implementing into the community. So I'm going to start with our maternal child health division within our department. It started July 2022, and we started offering prenatal home visits, specifically for non-English speaking mothers on Mass Health, young adults, so mothers who are 24 years and younger, and any mother with a history of substance use, mental health issues, or anyone in a military family. Those people, whenever they call the hospital, Cape Cod Hospital or Falmouth Hospital, to make their first OB appointment after they find out they're pregnant, if they hit any of those markers, they're automatically referred to our program. Our maternal child health nurses are certified lactation counselors and are really well versed in all of the community resources available to them. So if we have a Yarmouth mom who's in need of certain things, we're able to get them connected into the community. And I do have some numbers. Just going from this fiscal year, so July 1st through today, we ran some numbers. Our contract was able to cover one maternal child health nursing visit, which was wonderful, but we did a lot more than just one visit. We did 26 visits to 26 different families in the town of Yarmouth, but one of those was covered under a contract because they either didn't have insurance or they had an insurance that we didn't cover. For example, an insurance that was out of state. So thankfully with this contract, we were able to get this mom some support and connect them to resources.
Could I just, this chair, what are some of the things that you might, what does a newborn visit look like? So that listeners understand and the board maybe gets a better understanding.
Yeah, absolutely. So what I was just talking about was prenatal. So mom is still pregnant with baby. After mother has baby at hospital, they are automatically referred to our postpartum home visits, which is what we've been historically providing for many years. So when we go into the home, our nurses talk a lot about mental health. We do a lot of education around PMADS, which is perinatal mood and anxiety disorders. So we do a lot of education with the mother and with the family around different things to look out for and, educate them on what the expectations are after coming home with an infant. We do a lot of talk and education around safe sleep practices, sun safety, how to dress your infant properly depending on the season, feeding support. Like I said, our nurses are certified lactation counselors, so any issues around breastfeeding, we can address that, and we can make multiple visits too. If one visit isn't sufficient, we can come back a few times. And this contract would support a mother who either doesn't have insurance or an insurance that we don't accept.
Do you have multilingual capacity in that?
Yes, we have through Cape Cod Healthcare, being connected with that larger system, we do have access to over 300 languages. It is like a telephonic service, but we do survey our moms after the visits, and even the mothers who don't speak English are very gracious and, thankful that we were able to offer that support to them. All of our materials are translated into Spanish, Portuguese, and Haitian Creole, because those are the three most popular non-English languages that we see. So everything that we provide to them is translated into their language.
I have a question about the criteria. You said for women who are 24 or younger, is that mutually exclusive? So is that kind of a baseline, and then the other ones like military and all kick in, but they have to be 24 or younger?
They don't have to. That is, if they don't hit any of the other criteria, but they are 24 or younger.
Okay, gotcha.
Yeah. They don't have to hit all of them. They can just hit one. Or if the OB providers just, if there's a red flag for them about
Preference.
Somebody, then, they can refer whoever they want. But we are really targeting those.
So you get these folks in by referral
Correct.
from physicians?
Mostly from physicians. We also are getting referrals from different community agencies, which has been really wonderful. A baby center, family continuity, like all the different children's place, like all those different agencies know about our service and are able to connect us with moms.
How many women deliver in Yarmouth a year? Just rough.
I don't know how many deliver in Yarmouth. I know total last year there were just over 1,000 births at Cape Cod Hospital.
Okay.
And we also see if they're a resident of the town of Yarmouth but had their baby at BID Plymouth, for example, as long as they're a resident here, we will see them.
Do other towns offer similar services?
Yes,
Yes, okay, great.
most.
Okay.
All right, so that is our maternal child health nursing services. Just working our way up. We also offer a children's immunization program. So it's actually called the Vaccine for Children program, VFC program. We work with the state on providing free vaccine for children. Most of the children that we see it's our dentist's office that has our clinic room. Most of the children that we see are new to the area. They've moved here from out of the state or out of the country. They're not established with the PCP, and they need certain vaccines in order to attend school and camp. And those, so that's when we step in as that safety net service, and we're able to get them caught up on vaccines so that they can, be integrated into the community. And those referrals mostly come from either pediatrician offices or the school nurses. And in that program, from July 1st, 2022 through today, we did serve 13 children who reside in the town of Yarmouth.
If they needed something beyond that, are you able to connect them into, that labyrinth, the medical network? You're getting immunizations, which opens them up to whether it's school or things of that nature. But if it shows something else, are they already connected to a primary care?
Yeah, we do work with them as best we can to connect them with PCPs, especially those who qualify for Mass Health. We're able to connect them, fairly quickly, but it is a challenge here on the Cape.
No, I can imagine. That's what.
Yeah.
Yeah, it's difficult. Yeah.
Yeah.
Good.
Yeah. And again, we do use our translation services a lot for that service. As you can imagine, it's it's difficult enough to navigate the healthcare system when you speak the language and even work in healthcare, but, to not be connected with the system and to not speak the language just adds so many other layers.
Right.
And the criteria for these services are simply referral, right?
Yep, they just call. They just call us. We don't ask for insurance information. It's totally free. Anytime anyone's vaccinated in the state of Massachusetts, it's all documented in a system called MIIS, which is the Massachusetts Immunizations Information System. So we do document everything there just to confirm that, yes, they were vaccinated here. We do offer, sorry, I think I'm going a little out of order, but we do provide communicable disease surveillance and follow-up with the state. Another service that we work closely with the state through a system called MAVEN, which is the Massachusetts Virtual Epidemiologic Network. Over the last few years or so, that has really been COVID contact tracing. But aside from COVID contact tracing, we do, all the reportable diseases. There's 90-something plus. I don't think there's anything. Okay. Yeah, don't worry. I don't think there's anything like, there are about 90 different reportable diseases that are, anytime a Yarmouth resident goes to the hospital for something and is diagnosed with a communicable disease, it is reported to the state, and then the state will alert us through the MAVEN system. And so then we can call and start our investigation. And what we do is we gather information about the illness, and sometimes that's how it's connected back to a restaurant, for example, something like that, where we're able to, contain it, stop it in its tracks, and keep the general public safe.
Do you do contact tracing
For COVID?
for STIs?
Not STIs, no. There are certain reportable diseases that don't require follow-up, STIs being one, Lyme disease being another one. The other tick-borne, for example, so like babesiosis, HGA, ehrlichiosis, all those do require a phone call and an investigation, but there are certain ones that don't. Same with the food illness.
You said that does require contact tracing, no? The foodborne illness?
Yeah, most of them do, yeah.
Okay.
Yeah.
So the board understands what Meg's group does also helps and notifies, that then triggers the health inspector to go out to the restaurant to do a full inspection, case histories, things of that nature. So work very, it's hardwired to the health department, food division. That MAVEN system that she talks about is critical infrastructure, the work that the VNA does for the health department. It's relied on heavily, so that we appreciate that work is very important to us.
Yeah, it is. And it's crucial for, like I said, stopping disease and kind of getting to the root of, whatever caused the disease.
What are some of those? The TB, what would be some of the higher incidence numbers?
Yeah, so like COVID, for example, was an immediate, they call it, an immediate disease where when we get alerted, we have to act on it, within a certain amount of time. It's urgent. So tuberculosis is another urgent thing that we need to address as soon as possible. And we do see some tuberculosis cases in the town of Yarmouth. And that does require DOT, which is direct observation therapy, where we have to send a nurse to go out into the home and observe the individual taking their medications, and then ask them about their, side effects and symptoms and how they're managing that. And, we stay in touch with them very closely throughout the duration of their treatment, which is usually like 9 to 12 months for tuberculosis. Another service that we offer is our town public health nurse. So this service is similar to our traditional VNA home care division, except that we see a lot of people in the community who could benefit from a nurse coming into the home, but they don't necessarily qualify for various reasons based on Medicare rules and regulations. For example, if they come home from the hospital with a new diagnosis, a complicated medication regimen, and they're having a hard time navigating that, but they're not homebound, they wouldn't qualify for a nurse to come into the home because they're not homebound. But they could very well be, in their 90s and frail, and it might be very difficult for them to get out of the home. So that's when our town nurse comes into play. And we can go and make multiple visits. It's supported by the town contract, and we can help support the individual, teach them, educate them, and, help them advocate for themselves and help them to navigate their own healthcare. That's a really wonderful service. We get most of our referrals from the senior center, but also we've started to branch out into public safety, and we've met with the Yarmouth navigators over there to educate them on our service.
How about the case managers at the hospital? Do they refer to you?
We're just starting to get into that as well. We did have one recently from the cancer center. That's a great example of somebody who didn't qualify for home care, but needed some help in the home, and we were able to do that. Yeah. Next, I just wanted to give some information on some upcoming clinics that we have in the town of Yarmouth. One of them is our cholesterol screening clinic, and that is going to take place at the Yarmouth Senior Center Health Fair on May 19th from 1 to 2:30. We'll be there offering cholesterol screenings. We'll have an information table available. The cholesterol screenings, we've kind of been putting on this little road show recently, and they've been really well received, really busy, and we've been asked to come back and offer more because there's just such a long wait list of people interested.
This is something I think the audience, those listening and those, whether it's in reruns, what's the pre-work? Can anyone come to
Yeah,
see?
so at this setting, like I said, it's during a health fair, so it's open to the public, and they can come in and see, all the different vendors and the resources available. There's no pre-registration for this clinic. They would just come and, say they're interested, and they can get their screening and their numbers on the spot.
What particular readings do they get? Total cholesterol and what else?
I don't have that information. I don't know. I'm not familiar with these machines that we have. I'm not one of the nurses. So. Yeah. But then, it is a nurse that is offering the screening, so they are able to provide some additional education and information based on the numbers that they get back. Something else that we have coming up in Yarmouth is our Walk It Out Challenge. It's actually a presentation by one of our physical therapists, and this one you do have to call the senior center ahead of time and just let them know you're going to be there. We just need to know how many handouts to bring. That's been really well received in other towns. That's a new presentation. So that one's coming up. Oh, I'm so sorry. That one was on May 9th. I'm sorry. And we did have 10 participants in that one. We also offer exercise programs. This is part of our wellness programs. I was saying we had clinical services and wellness programs. These are part of our wellness programs. We do have a Stepping Stones to Exercise class coming up on the 26th. We have an exercise physiologist on staff with us. When she first started with us almost 2 years ago, she went around to the different senior centers, including Yarmouth, and asked, what are the needs? This was 2 years ago, right? Still in the, the heat of the pandemic. What are the needs? What are you seeing? What's out there? And the feedback that we were getting was that people are so deconditioned from being sedentary for so long and being isolated for so long. Mental health was declining, but also like their physical well-being was declining as well. So we created the Stepping Stones program as a stepping stone for them to be able to participate in the regular exercise programs that the senior center offers. So this one kind of gets them into a better place, kind of like the preparation before other exercise programs. Another exercise program that we've offered a couple of times over the course of this year is called Fit and Strong. That's an evidence-based program. It's an hour of exercise and 30 minutes of education twice a week for 12 weeks. That one is really popular in Yarmouth. Like I said, we've offered it a few times, and all wonderful feedback from that. We do have surveys. I should have brought some testimonials with me, but we do collect surveys from our programs, and it's been really well received. I think that's a really high level overview of what we offer, but we are just really grateful for a relationship with Jay and with the senior center, and strengthening relationships in the community, and continuing to serve the residents of Yarmouth and keep everyone healthy.
We're glad to have you.
Thank you.
Thank
Any
you.
questions? Eric?
Eric?
No?
No, thank you very much.
Keep
Meg-
up the good work.
Yeah, Meg, you just kind of gave an overview, but I see it day in and day out, what your staff does. We're sharing emails on a regular basis. I sat down early on in my tenure time here with some of our staff, and very creative in what they're looking to do, whether the programs, to include an aquatic program. There's some things still in the pipeline that you're looking to do to expand, so these are some of the immediate things, but year-round, there's a number of different things. I see it, and Yarmouth is well-served by the VNA, so we appreciate the partnership. We sincerely do, so I'd say this, just keep up the good work. But thanks for coming in.
Thank
Let
you.
the board know and the community know what the VNA does here.
Thank you.
Thanks.
Meg, I have some extra handouts here you might want to take and use them somewhere else. Thank you.
Thank you.
Yes,
Yeah,
I'll
yeah, yeah.
take those, yeah. The next item on the agenda is an update from Haley O'Neill. Haley is the young lady that presented two articles on the warrant at the town meeting, April 25th, did an excellent job. They both involved plastic and non-compostables. So she is here today to give us an update. We had received a copy of the town warrant in our packet for the meeting, so we were able to read the articles, I hope. And just tell us a little bit about yourself, too, if you would.
Yeah, of course. Well, first I'd like to just thank the people of Yarmouth for voting yes on both Article 34, the plastic reduction bylaw, and Article 35, the commercial single-use plastic water bottle ban. The passing of these articles will help reduce plastic waste in our town. They also take the responsibility of avoiding plastic in our food and beverage products out of the consumer's control and into the businesses. I am part of the group Sustainable Practices, which is an environmental advocacy group. They are the reason that I did this. I joined, I just graduated college this year. I've been living on Cape for the last 5 years, year-round, and my parents and grandparents all grew up here. So when I saw a group was doing something to help the environment and the people, I definitely wanted to be a part of it. And it's been a really great experience getting involved in local government. So just to talk a little bit more, when the plastic reduction bylaw goes into effect January 1st, 2025, plastic takeout containers and cutlery will be prohibited from being used at food establishments for prepared food on site. This includes plastic types 1 through 8, and this bylaw excludes beverages, so cups will not be banned under this bylaw. The commercial single-use plastic water bottle ban will ban the sale of single-use plastic water bottles in our town. It does not affect the sale of any other beverages besides water. We are currently working with different organizations to help us seamlessly transition away from plastic takeout products and would appreciate sharing our thoughts when we have a more formal response. I would like to attend the next meeting for further discussion when I have better clarity on the situation. We're meeting with the Chamber and Jill Talladay from Care for the Cape and Islands, as well as hopefully the Yarmouth Restaurant Association and other groups in the Recycling Committee. Yeah, just setting up meetings so we can help,
Right.
you know,
Coordinate and collaborate and make it even more powerful and effective, hopefully.
yeah, hopefully.
Thank you. Any questions, Charlie?
Beg pardon?
Any questions?
I don't think any of our plastic's been going into a landfill for a long time. It's been cooked. They truck it off the Cape and incinerate it.
Yeah. Yep. Still not very good for our health or our environment. So, also this bylaw, it's, you know, it's about the disposal, but it's also about like the consumption when we're eating all this stuff off plastic. It's not good for us. Microplastics in our body. Lots of new studies coming out. I'm happy to send over, I should have done this prior to our meeting, but there's a really good study I can send you about that.
And this is a worldwide problem. It's not just here, so this is a small step we can take as a town to do something.
Yeah, absolutely. And Harwich also passed the plastic reduction bylaw, so they will be with us in this, as well as hopefully other towns in the future in Cape Cod.
Especially neighboring towns, because that's what sometimes the retailers are concerned about.
Yeah, 100%.
Eric, any questions?
No questions. Thank you.
Haley, if I could, first of all, thank you for coming in. I didn't realize you're just a college grad, not just, you're a recent college grad, just starting out, so thank you for this. I know it was back and forth, and this didn't actually, the board should know, this didn't fit her schedule tonight, and she came in at some point, though, because the Board of Health, you know, public health is about education and engagement, and the more information, when you talk about a more comprehensive presentation, that would be extremely helpful for the board members, and then also in down the road, the community, so they fully understand, and to be engaged in this. That today to come in and thank, and that's important. But then later on, the next meeting is June 5th. I'll be in touch with you. I don't know, they may fill up with some other things. But do you think in the not too distant future, a full presentation, maybe the executive director, to give a full understanding, so the board knows, and then the community will have a better understanding of what this entails?
Oh, yeah, absolutely. I'd love to put that together for the next meeting.
Okay.
Mm-hmm.
That's
you.
terrific. We can do that.
Yeah, great.
Thank you for
Thank
coming
you.
in.
Thank you for coming in.
Thank
Okay.
you guys for having me.
Thank you for coming.
Thanks.
The next agenda item is our ever-present, we have somebody
We
else.
just, yeah, well, Roby is here from DPW. Roby, I didn't know if you wanted to talk at all?
I'd be happy to say a couple of words.
Sure.
I know I'm not on your agenda, but
But it's under the same topic.
under the other, yes.
Yeah.
So, yes, hi, everybody. I'm Roby Whitehouse. I am the Assistant DPW Director here in Yarmouth, and I just want to clarify. All single-use plastic is required to be recycled here in Massachusetts. It is one of the waste ban items. So single-use plastic goes into our commingled container at the disposal area, and it is shipped out to E.L. Harvey, who is a MRF who does recycle plastic. So I just wanted to make sure we
But
clarify.
that's only number ones, right?
Single-use plastic is more than number one. It's just the only single-use plastic that we don't accept is black plastic.
Oh, so you accept all of the other numbers?
We do.
Didn't know that. You're going to get a lot more from me, unfortunately.
Yeah, the only exceptions to that rule, and we usually say if it's smaller than an inch,
Yeah.
it drops down in the conveyor belt and goes right in the trash. And we usually, I'm actually going to have two presentations coming up on the 21st and 22nd at the disposal area. We hope to get people more engaged in recycling and understanding what recycling means to the town of Yarmouth, what the priorities are, and really what to avoid. Thinking of things that will not be recycled is really important. Things like water hoses and electric cords. As much as those are recyclable in some places, they're not recyclable in our container. I also wanted to touch base, I'm really glad to hear that Haley is here, but I also wanted to remind everybody about a couple of other articles that have passed in the past, so going back in time. In 2020, we had the single-use plastic container ban that went into place in schools and in town properties, sailed by the town. So we're not allowed to do that on town property, so no single-use plastic containers. And then last year, we had the polystyrene ban, which was brought before the annual town meeting by the Recycle Committee. And I shared that with Jay because Jay wasn't here at that time, so he is aware of that. I also wanted to go away from the recycling piece just a little bit, but talk about still recycling, but not plastic. There will be a latex paint recycling event in town of Dennis in the Tony Kent Arena. It's open to all residents of the town of Yarmouth for latex paint. And we'll make sure that Jay has that, and we'll get it posted out there on social media as August gets closer. But we want to make sure that people understand that latex paint is recyclable as long as it's not frozen, it's not rock solid. As long as there's some squishy sounds in there, they'll take it. And the purpose of that is the company that is recycling it is actually creating new paint, and it's being sold at the restore. So it's a full circle. The other thing is we always have our hazardous waste collections. They're taking place on July 15th and October 7th, again, from 9 to 12 at the Yarmouth Senior Center. And I was really, like I said, very grateful to hear Haley speak. We hope that she will come and talk to the Recycle Committee and help with this new rollout of these new articles, because and I'm so glad to hear that she's going to be with the Chamber of Commerce and meeting with our other community members and really getting involved in the process, because it's really great to come at this after a bylaw has passed and then to take it to the next level and make sure that it actually happens. So I didn't have any specific things other than that to say to you, but I wondered if you had any questions for me. I think the last time I was before you was when we were talking about this polystyrene ban.
Right.
And we talked about the health hazards of heated up polystyrene. Do you have anything for me for, no, waste management?
Eric?
Yeah, hey Roby, how are you? Good to see you.
Hey, good to see you.
Hey, so I saw the sign this past weekend about plant pots, and I heard you mention black plastic is not recyclable at our facility. And can I just ask why that is? What is it about those plastics, just from my understanding?
Yeah, I've heard a lot from a lot of different garden centers. And honestly, I've asked the garden centers, how come you don't recycle them? Why are you not shipping them back to your buyers, your salespeople? And their response was, well, remember a few years ago when we had that one plant that was contaminated with a bacteria? It was the Impatiens.
Yeah.
Well, they started a precedence. They did not want them back after that. There was a fear that if we ever had a problem again, that they would be responsible for it. And the other piece of it is the recycling companies don't want it because of the contents and the soil that's in it. That's the story that I'm getting. And it's just one of those things that because E.L. Harvey is our vendor, those are the two key pieces that they're telling us, the soil and also the possible bacteria or contaminant.
So it's really specific to plant pots. In other words, if I bought mushrooms, usually come in a small black plastic
I'm
container
sorry.
that's
Those are
recyclable.
two different things we have going
Okay.
on. The black plastic is different. The black plastic is because E.L. Harvey has a conveyor belt with eyes, sensors, eyes that actually can only see certain colors. And the color black is not a color that it can see, so it automatically drops it right down onto the ground into the trash.
Okay, so black plastics in household trash.
You got it.
All right, and styrofoam.
And styrofoam and garden hoses and anything that, if we think about that conveyor belt and you think about what might clog the conveyor belt or slip between, those are things those are no-nos.
Awesome, thank you very much for the
Oh,
clarification.
Absolutely. Yeah, I'm always happy to answer recycling. You know, at Rotary, they always say, we love it when you talk trash.
So Roby, at the next meeting would be June 5th. I'll see what Haley and her organization, if they are queued up and ready, perhaps maybe, and you can be a portion of that presentation to the board to give a better understanding of what you just did now as far as recycling, how the whole recycling center works, and how they can work in conjunction with one another. The rollout of the polystyrene and the plastic bottles and things of that nature. Maybe if you could be part of that, that would be wonderful.
I'm happy to be here. I can't really speak too much on those two articles because I haven't really had that much to do with them. I can speak to what I've read, and I'm sure you can as well. But it's really putting it into an enforcement category.
Right.
We all need to kind of work our way through.
That's right. With good information, though, and education and messaging, we'll come to a good answer on that.
Absolutely, yes.
But your DPW needs to be a part of that, so
Absolutely.
you've been very helpful to the
Anytime,
department. So thank
anytime.
you.
It's always a pleasure.
I appreciate you being here. And-
Absolutely.
Yeah, nice.
Can we go to coronavirus now?
Mary, yes, we can.
Wait,
So here we go.
even better.
It is looking better, yeah. So as of May 11th, last Thursday, the federal government dropped the emergency designation for COVID as being a pandemic. So that triggered a number of different things. Most specifically being the test kits, things of that nature. So a lot of the mandates have dropped off, and our numbers reflect that. I think the timing is right, but so everyone understands, it's off our website. We don't have the red banner anymore. The mandated requirements and things have all fallen off. A lot of the testing sites have closed up, and you'll see that that's not involved. It's not included in our presentation anymore. As a matter of fact, Roby is taking them off on some of the, I think it's our recreational or beach and recreational areas where it's not mandated. The warnings aren't there anymore, so we're now down to more of a virus status than a pandemic. But let's just go through. As we see our active cases, although this has been low for some time, but now we're in the single digits. We have 4 active positive cases in Yarmouth right now, and that is wonderful news. We've had a long time for that. April numbers have now come in, and they're just as we had predicted. You can see the decline very quickly in December. Again, indoor, holidays, things of that nature. There was a spike, but since the end of last year, you can see quickly it's almost 50% reduction right down the line. And right now, April was at 30 active cases. All right, and in Yarmouth, so our positivity rate is this one here. Yeah, it's at 2. Christine, I'm going to have you from across the board. Is it
There you go.
just over 2, which is tremendous. Look at where we are across the Cape. At sometimes we had been in the top, the top tier, the top 2 or 3, and at 2% positivity rate, that's a significant achievement, and certainly welcome news. All right. Go ahead. Fully vaccinated, these numbers have not shifted, although the metrics have changed of what is actually fully vaccinated what is considered fully vaccinated, although that has changed and upped our numbers, but really, the numbers haven't changed all that much, at all, really. Fully vaccinated, and then second boosters, same thing, fairly stagnant in numbers, but we still encourage individuals, depending on the circumstances, and there is availability, go ahead, Christine, that's still, that is still available, that website, it's the vaccine finder, Vax Finder, I should say, is available, and that's through the state, to be scheduled. Go ahead. What would have been in here right now is the testing. Go ahead, you can go back to the testing is no longer available. Well, I should say that it's available through primary cares, urgent cares, things of that nature, but we don't have the kits anymore. And talked to CVS today, they're not doing the testing. I believe Walgreens maybe have some capacity, but the testing has really diminished, and the sites have diminished. Here again, we see now Yarmouth, this is month over month, or several weeks anyway, over time, and the numbers would, again, just over 2%, and that is just tumbling, downwardly adjusting. So we feel very, very positive about that. And that would bring us to our mask advisory. That was adjusted last time to include crowded indoor facilities. We made that adjustment. Actually, the adjustment at the last board meeting, and it triggered a call from the Cape Cod Times. They wanted to know if maybe there was something that they were missing. And I said, well, it was more wordsmithing and, adding a word so that people fully understand what the board was trying to communicate. If the board, or maybe wants to wait till we have a full complement of the board to make a determination?
I'd like to do that. I mean, I think it certainly looks like it's going to be warranted to just take that off.
Right.
But I'd rather wait till we get
Makes good sense.
all of us here.
Okay. Right. But, so the board and the community understands the numbers have dropped off significantly. And it's been a long time in coming. Okay,
That it?
that's it.
Okay. Is there any new or old business?
Well, I don't know, the new business would be at the previous meeting, the 24th of April, the board passed the the connection policy for wastewater. That following day, at town meeting, the town passed the comprehensive wastewater treatment plan. So the policy that the board approved sits for 20 days, and that expired yesterday. It sits in the clerk's office for 20 days for comment. There have been no comments, so the board has started to sign. The two members here have signed. Eric, you and Hillard will get you over the next couple days to sign that, and that will then be in effect. So that's important, that comprehensive wastewater has passed, and simultaneously the board held up their responsibility and for the connection policy. That will mature over time, and there's going to be some things that we're going to have to, what the tracking will look like. We'll keep you, the board updated, but in the fall, September, they expect to break ground. Contracts are out, and that work will begin. Okay. So that is new business.
Any old business? Seems to me there was something else we talked about last meeting that,
Well, this is going to be under as you schedule the next meeting. If I could jump to that, the old business would have been that we have 3 candidates coming in
Yes.
on the June 5th meeting.
Yes.
So the June 5th, if you don't mind, I'm going to jump to that. The next meeting would be on Monday, June 5th. And we'll be bringing in 3 candidates to fill the vacancy on the Board of Health. We additionally have, I've asked for the Bob Collette, who runs the Barnstable Tobacco Control Program, to come in and give some updates. The board has adopted the punitive, the penalty phase of this, but to talk a little bit, there may be some other updates, and unfortunately, we're going to be bringing in that same June 5th meeting 2 establishments who now have had their second violation. And we'll have them in front of the board on the 5th. And that, if you follow, as you probably can remember, that means a $2,000 fine and a 7-day suspension. So we'll discuss that in detail at the next meeting on June 5th. And also, I would like to start bringing in, like we did the VNA, some of the nonprofits in our community. I thought, the food pantry is one. There's several that I'd like to start bringing in. I know maybe that's going to wait till the fall. I don't know if you go on a lighter schedule for the summer, perhaps
We typically skip at least one meeting in the summer.
a month or a meeting. Like July, do you take off, or
Usually it's a month.
a month, right?
Right.
And,
That depends. I mean, if there's
understood.
business we need to attend
right.
to.
Well, these candidates, that would be one. And again, it's
Absolutely.
the interview for a recommendation to the selectmen.
You've already given us copies of their applications.
They are, and notified that they'll be in. But we'll going forward, we'll see what the chair
Right.
and the board wants to do as far as meetings, but understanding that we can go to more of a skeleton schedule through the summertime. But the June 5th meeting is locked in place,
No, absolutely.
okay?
Typically, that's not till like July or August that we
Okay.
take that time.
And then the only other thing I would like to recognize is that Erica is away, and I'd like to thank Christine Slack for coming in, filling in here. I know she's been here before. It's been some time, but on it really slipped my mind that Erica was not here, and I know, and I rely on Erica quite a bit. And Christine graciously came in and said, "No problem at all, Jay. I can be here." So thank you, Christine, for being here tonight. We very much appreciate it. Putting the packs together and
Thank you,
and the
Christine.
slideshow. Thanks, Christine. It's always much appreciated.
If there's nothing else, I will take a motion for adjournment.
Second?
Okay, we are adjourned. Thank you very much.
Thank you.